Hey everyone, welcome to Plain Talk. I'm Ryan.
And I'm Sarah, happy to be here.
Sarah, how you doing today?
Honestly, a little fired up.
Yeah? What happened?
So I got a bill in the mail yesterday for my doctor, $340.
For what?
A checkup, 15 minutes. He asked me like 4 questions and sent me home.
$340 for 4 questions.
He didn't even look up from his iPad for half of it.
Okay. Okay, so that is actually the perfect intro to today's topic.
It really is.
But real quick, if you're new here, welcome to Plain Talk. We talk about real American issues. No spin, just 2 people having an honest conversation.
And if you've been here before, thank you so much. Seriously, please subscribe if you haven't. It helps us more than you know.
It really does. Okay, Sarah, today's topic.
I'm already emotional about it.
Today, we are talking about American healthcare, why we pay more than any country on Earth and somehow get less than almost all of them.
And there is a twist at the end that genuinely made me angry when I found out.
Like, actually angry?
Like, throw your phone angry.
You ready?
Let's go.
All right, so let's start with a number. $15,474.
That's a lot of dollars.
That is what the U.S. spends on healthcare per person, every man, woman, and child, per year in 2024.
Per person?
Per person.
So like my share, your share, my grandma's share?
Everybody's share, $15,400.
Okay, and that sounds like a lot, but maybe we're just getting really, really good healthcare for that.
We rank last.
I'm sorry?
Dead last. Out of 10 of the richest countries in the world, the United States is at the bottom for health outcomes, last place.
We're paying the most and finishing last.
We're paying the most and finishing last.
That is, I don't even have words.
That's the whole episode. That's the question we're answering today. How did we get here? What's happening right now? And, this is the part that's going to mess with you, who is actually making money off of this? Okay, so let's go back, way back, 1970.
Before either of us were born.
Way before. So in 1970, you know what the U.S. spent on healthcare per person?
I'm guessing way less.
$353.
300 versus 15,000 today?
And even if you adjust for inflation, in today's dollars, it was about 2,200. We have gone from 2,200 to 15,000. That's a 7 times real increase.
So everything gets more expensive over time though, right? Like groceries went up too.
Not like this. Healthcare inflation is completely different from regular inflation. It's been growing faster than the economy literally every single year for decades.
So when did it start going round?
So here's the thing most people don't know. It actually started during World War II.
World War II? That's not what I expected.
So during the war, wages were frozen. The government said you can't raise salaries, we're in a war. So companies that needed workers, they started offering health insurance as a benefit instead, since they couldn't offer more money.
Oh, so that's why healthcare is tied to your job here.
Exactly. And that's a uniquely American thing. You don't see that in Canada or the UK or Germany. And that one decision, healthcare as a job perk, not a basic right, that's the domino that falls first.
Because what happens when you lose your job?
You lose your insurance, and suddenly you're one bad diagnosis away from bankruptcy.
I've literally heard people say, I can't quit, I need the insurance.
Everyone has heard that. Everyone has probably said that. So that's domino 1.
What's domino 2?
1980s. Hospitals start consolidating. Big hospital systems buying up smaller hospitals, buying up doctors' offices, building these massive networks.
Which sounds efficient.
Sounds efficient, but what it actually means is when one hospital system owns every hospital in your area, they have zero competition. They can charge whatever they want.
And you can't exactly shop around when you're having a heart attack.
Nobody's going, actually, let me check if St. Mary's has a better rate on this emergency surgery.
Right.
And then on top of that, insurance companies are doing the same thing, consolidating, getting bigger. So now you've got giant hospitals and giant insurance companies negotiating prices between each other, and the patient has no idea what anything costs and no power to change it.
So we're just like in the middle, getting charged whatever they agree on.
Exactly. Then, 2010, Obamacare, the Affordable Care Act.
Okay, this one is spicy. People have very strong feelings.
Very strong. So what did it actually do? It expanded who could get covered. More people got insurance. That's real. That's a good thing.
But
But it didn't really touch why prices were so high in the first place. So now more people have insurance, but the insurance costs more, the hospital bills are still crazy, the drug prices didn't go down.
So it's like you gave more people a ticket to a show that keeps raising ticket prices.
That is such a good way to put it. More people in the door, same broken system inside. Okay, present day, 2024, 2025. What is actually happening right now?
Because it feels like it's gotten worse recently, like noticeably.
It has. So here's a stat that I think is going to hit hard. 29 million Americans in 2024 were what researchers call cost desperate.
Cost desperate meaning what exactly?
Meaning they cannot afford to pay for the medical care they actually need. They need treatment, they cannot pay for it. 29 million people.
That's like the entire population of Texas.
The entire population of Texas cannot afford their health care.
And these are people without insurance?
Some, yes, but a lot of them have insurance. Having insurance doesn't mean you can afford care anymore.
Because of deductibles.
Deductibles, co-pays, out-of-pocket maximums. A lot of people have a plan where they pay like $400 a month in premiums, and then they still owe $3,000 to $5,000 out of pocket before insurance actually covers anything.
So you're paying every month and the insurance still isn't helping you.
It's insurance that doesn't really insure you until you're already in financial trouble.
That's kind of the definition of a scam.
I'm not going to say that on the record.
Fair enough.
And the gap between rich and poor, it's brutal. People making under $24,000 a year, 25% of them are cost desperate. People making over $180,000, 1%.
So this is almost entirely falling on lower income people.
Lower income people, but it's spreading into the middle class fast. In 2021, it was 29% of adults saying they couldn't afford care if they needed it today. In 2024, 35%.
It went up 6 points in 3 years.
6 points in 3 years. That's not a slow trend. That's accelerating.
What about prescription drugs? Because that feels like its own disaster.
Prescription drug spending went up 12.9% in 2024, almost 13% in 1 year.
My paycheck did not go up 13%.
Nobody's did. And the U.S. pays, depending on the drug, anywhere from 2 to 10 times more than Canada or Germany for the exact same medication. Same pill, same company made it, costs 10 times more here.
How is that legal?
Because in other countries, the government negotiates drug prices. The U.S., until very recently, was literally prohibited by law from doing that.
Wait, prohibited by law from getting a better deal?
Correct. The Medicare Modernization Act of 2003 explicitly prevented Medicare from negotiating drug prices. That law was basically written by the pharmaceutical industry.
So the pharmaceutical companies wrote a law that said the government cannot negotiate lower prices for their drugs.
Correct. And we just let that happen. America. The Inflation Reduction Act in 2022 started to change that. Medicare can now negotiate on 10 drugs initially.
10. Out of how many?
Thousands. So it's a start.
A very small start.
A very small start. And now there's political pressure to undo even that.
Of course there is.
And here's something wild about hospitals. In 2024, Medicare was only paying hospitals 83 cents for every dollar of care they provided. So hospitals actually lose money on Medicare patients.
So how do they make money?
They charge private insurance patients way more to make up the difference. And in 2025, hospitals spent $43 billion just fighting insurance companies to collect payments that were already owed to them.
$43 billion on paperwork fights?
$43 billion just in billing disputes. And guess who ends up paying for all that waste?
Us.
Through higher prices. Always us. Okay. So let's talk about what other countries are doing, because I know some people are going to say, yeah, but American healthcare is the best in the world.
I've definitely heard that.
And it's partially true. For certain things, complex surgeries, cancer treatment, if you need a very specialized procedure, America genuinely has some of the best in the world. If you have great insurance and you need cutting-edge treatment, you want to be here.
But for regular, everyday people?
But for regular, everyday people, we are getting lapped. Life expectancy in the U.S. right now is 79 years. The average across comparable wealthy countries, 82.7.
Almost 4 years shorter lives?
While spending double. Switzerland spends about $10,000 per person on healthcare. Germany, about 7,000. The average wealthy country, not counting the US, $7,300.
So we spend double and live shorter lives.
And we have the highest rate of preventable deaths, deaths that shouldn't happen if you have decent health care, the highest rate out of all comparable rich nations.
People dying of things that could have been treated.
Treatable conditions. And maternal mortality, mothers dying in childbirth, the US rate is more than double Canada's, 3 times higher than the UK and Australia.
In 2025, that is not a statistic I expected to hear.
We're seeing a noticeable shift in consumer preferences across several sectors. What seems to be driving this change?
It appears to be a combination of factors, including greater awareness of sustainability issues and a growing demand for personalized experiences.
It has some truth to it, but here's my counter. If your healthcare system can't deal with the actual health problems your population has, that's still a system failure. You don't get to say, our people are sicker, so it's okay that our healthcare is worse for sick people.
That's like saying my car breaks down more because I drive it more. The car still needs to work.
That's exactly it. Okay, where does this go from here? What's the future look like?
Give me something hopeful, please.
So the projection is, by 2033, healthcare is going to be 20% of the entire U.S. economy, 1/5 of everything America produces, just healthcare.
That's not sustainable.
Mathematically, it has to change. The question is how.
So what are the options?
Okay, I'm going to give you both sides here, because I think people deserve to hear both arguments honestly.
I appreciate that.
Left side, Medicare for all, universal coverage, government pays. Government negotiates drug prices like every other country does. Supporters say it would actually save money overall because you cut out insurance company profits and the insane administrative costs.
Arguments against?
Big tax increases. 2 million people work in private health insurance. What happens to them? Concerns about wait times, and some people argue removing profit motive would slow down medical innovation. Those are real concerns.
And the right side argument?
More market competition. Let insurance sell across state lines. Health savings accounts. Less regulation so prices compete down naturally. The core argument is government involvement is part of what made prices so high. Medicare and Medicaid set price floors that private insurers then build on.
Is there evidence for that?
Some. It's genuinely complicated. Both sides have data that supports their argument and data they'd rather you didn't look at.
Classic.
What's actually happening right now, though, the Inflation Reduction Act drug negotiation is expanding slowly. Price transparency rules are requiring hospitals to post their prices publicly now.
Are hospitals actually doing that?
Compliance has been spotty, but it's a start.
And the scary future stuff?
The enhanced ACA subsidies that were helping millions of people afford marketplace insurance, those expire in 2026 unless Congress renews them. If they don't, an estimated 4.7 million people lose coverage.
In 2026? That's right around the corner.
That is the political fight happening right now as we record this, whether Congress acts or lets those subsidies die.
And if they die?
Millions of people uninsured overnight. Okay, the twist. Sarah, you've been hyping this.
Because it genuinely changed how I see all of this.
So, you know who the single biggest spender on healthcare in the United States is?
Insurance companies?
The U.S. government. The
Government?
federal and state governments combined. Medicare, Medicaid, VA, government employee benefits, they pay for about 47% of all healthcare spending in America.
Almost half.
Almost half. Now here is the part that messed me up. The U.S. government, just from that public spending alone, spends more per person on healthcare than the entire healthcare systems of most other wealthy countries.
Wait, say that one more time.
What the U.S. government spends on healthcare per person, public money only, not counting any private insurance, is higher than what Canada spends on healthcare total, higher than what the UK spends total, higher than what Australia spends total.
So we already spend enough government money to cover everybody.
The math says yes. We are already paying for a universal healthcare system. We're just not getting one.
Then where's the money going?
Insurance company profits, pharmaceutical company margins, hospital billing departments, administrative overhead. In the U.S., roughly 34% of every healthcare dollar goes to administrative costs. In Canada, it's 12%.
A third of every dollar just on paperwork and middlemen?
A third. And here's the uncomfortable political part. The people who benefit from keeping it exactly this way, insurance companies, pharmaceutical companies, hospital executives, they donate to politicians. both parties.
Both parties.
The top recipients of pharmaceutical industry donations in recent election cycles, Democrats and Republicans. This is not a one-party problem. Both sides are taking the money.
So the system isn't broken.
Say it.
The system is working exactly as designed, just not for us.
That might be the realest thing said on this podcast. All right, that is plain talk on American healthcare.
I need a glass of water after that.
Here's what we want you to take away from today. This is genuinely complicated. Anyone who tells you there's a simple fix is lying or selling something.
But, and this is important, it is not a money problem. The money is there.
It's a political will problem, and political will comes from people like you paying attention and making noise.
We want to hear from you. Drop a comment. What's your worst healthcare bill story? Because I guarantee everyone watching has one.
And if today's episode made you think, share it. That's honestly the biggest thing you can do for us.
Subscribe to Plain Talk. New episode every week.
Next week, rent prices. Why can nobody afford to live anywhere in America anymore? Sarah already has feelings.
I have so many feelings about rent.
I know. That's why you're here. I'm Ryan.
I'm Sarah. This has been Plain Talk.
Stay informed, stay honest. See you next week.